Testosterone therapy has become one of the most debated treatments in modern medicine, especially in the UK and USA, where millions of men search for solutions to low energy, declining libido, fatigue, and age-related hormonal changes. But what if the treatment that promises vitality could also be linked to an increased risk of heart attacks? Today on MedLogic, we're taking you inside one of the most controversial medical discussions of the last decade, cutting through misinformation, hype, and fear with clear scientific evidence to answer a critical question. Does testosterone therapy really increase your risk of heart attacks, or is the story far more complex than headlines suggest? To understand this, we first have to talk about what testosterone actually does in the body. Testosterone is not just a male hormone. It affects muscle mass, red blood cell production, fat distribution, mood regulation, bone strength, metabolism, and sexual health. Naturally, testosterone levels begin to decline after age 30, leading many men to seek hormone replacement therapy, or testosterone replacement therapy, TRT. But as TRT clinics exploded across the US and UK, medical researchers began noticing patterns. Some men on testosterone therapy were showing increased cardiovascular events, particularly heart attacks, strokes, and clotting issues. Suddenly, what was once marketed as a miracle anti-aging therapy came under heavy scrutiny. Early observational studies, including a widely cited 2013 paper, suggested that older men on testosterone therapy had a higher risk of heart attacks, especially those who already had underlying heart disease. The media amplified this, creating fear and confusion. But here's the twist. Later randomized controlled trials, the gold standard of medical research, started painting a different picture. Some studies found that testosterone therapy actually improved cardiovascular health by reducing fat mass, increasing lean muscle, lowering insulin resistance, and improving cholesterol ratios. So how can two types of studies come to such different conclusions? Because observational studies can only show correlation, not causation. Many men who seek testosterone therapy already have pre-existing health issues: obesity, diabetes, high blood pressure, metabolic syndrome conditions that independently increase heart attack risk. So, was it the testosterone causing the problem, or the underlying health problems that prompted them to seek therapy in the first place? The truth lies in understanding how testosterone interacts with the cardiovascular system. Testosterone therapy can increase hematocrit, the thickness of your blood, by stimulating red blood cell production. Thicker blood can increase the risk of clotting, which may trigger strokes or myocardial infarction in vulnerable individuals. It can also slightly increase LDL in certain men while improving HDL, good cholesterol, in others. This variability is why proper medical supervision is absolutely essential. In the UK, TRT is more tightly regulated under NHS guidelines. In the US, however, direct-to-consumer clinics often advertise testosterone as a lifestyle booster, sometimes without thorough testing or follow-up. This difference in healthcare culture means outcomes can vary dramatically between populations. But the key question remains: does testosterone therapy inherently cause heart attacks? According to recent large trials, including the TRAVERS study, one of the biggest clinical trials on this subject, testosterone therapy did not significantly increase the overall rate of major heart attacks compared to placebo in men who were properly monitored and had clinically low testosterone. However, there were some important warnings. Men with very high hematocrit levels, uncontrolled high blood pressure, untreated sleep apnea, or severe heart disease had higher complication rates. This means testosterone therapy can be safe when used correctly, in the right patients, and with the right monitoring. But when men take testosterone without medical guidance, use injections from non-regulated clinics, overuse boosters, or combine TRT with anabolic steroids, the risk skyrockets. Many heart attacks linked to testosterone therapy in news stories actually involve men misusing high-dose anabolic steroids, which are dramatically different from medically supervised TRT. Another factor often ignored is that low testosterone itself is linked to poor cardiovascular health. Men with chronically low testosterone have higher rates of abdominal obesity, inflammation, insulin resistance, and metabolic syndrome, all of which increase the risk of heart attacks. So sometimes, treating low testosterone may actually reduce long-term cardiovascular risk. What this means is simple. Testosterone therapy is neither a miracle cure nor a guaranteed danger. It's a medical treatment with benefits and risks, just like any other therapy. The biggest mistake is when people self-diagnose based on internet videos or go to a walk-in clinic that sells testosterone packages without checking your full hormonal profile. Proper TRT requires a full assessment. Total testosterone, free testosterone, LH, FSH, SHBG, hematocrit, lipid profile, blood pressure, underlying cardiovascular health, and sleep quality. A responsible doctor like Dr. Rohin Francis, well known for his clarity on evidence-based cardiology, would never prescribe testosterone simply because someone feels tired. Instead, he would analyze the patient's overall health, cardiovascular risk factors, lifestyle habits, and whether the symptoms actually correlate with low testosterone levels. Many men seeking TRT are not suffering from hormonal deficiency, they're suffering from stress, poor sleep, obesity, undiagnosed depression, nutritional deficiencies, or lifestyle imbalances. TRT won't fix those. In fact, it may distract from the real underlying issues. But for men with confirmed hypogonadism, properly monitored testosterone therapy can significantly improve quality of life, energy, mood, libido, muscle mass, bone health, and metabolic strength in ways that genuinely reduce long-term cardiovascular risk. The problem isn't the therapy itself, it's the misuse, overuse, and lack of medical supervision. When done right, TRT can be life-changing and safe. When done wrong, it can be dangerous. So what should you do if you're considering testosterone therapy? First, never self-medicate. Second, get a full hormonal and cardiovascular evaluation. Third, work only with licensed physicians who monitor you every 3-6 months. Fourth, focus on sleep, nutrition, exercise, weight control, and stress, because testosterone therapy works best when your lifestyle supports it. Fifth, understand that more testosterone is not better. Proper dosing is the difference between healing and harm. And finally, always remember, your heart is not something to gamble with. Medical decisions should be based on evidence, not marketing. If you're thinking about testosterone therapy or already using it, this is your reminder to make informed, safe, medically guided choices. And if you want more clear, science-based medical breakdowns like this delivered in simple, trustworthy language, make sure you subscribe to MedLogic right now. Your health, your logic, your life. Subscribe today.